Chinese medicines, and it was known as Mahuang decoction. And the boiling process and the other herbs were believed to mitigate the stimulating process. And in USA, what happened? They were sold in concentrated forms, isolated doses, often combined with other stimulants. Means to add to it, to make it more worse, caffeine was also added. So regarding the dosage, it was originally in the supervision. It was originally given in China in a supervision of a practitioner, but the dosage was a part of a holistic medicinal formula. And what happened in the Western world? The instruction for the use frequently unregulated and often disregarded by users, seeking stronger effects. And as expected, the side effects, the misuse and the high use of concentration of this drug including increased the blood pressure, it created heart palpitations and also psychiatric problems. So this is just a thing, just an example of many examples. You can take it, you can search through the internet and you will get it. So this is one reason why the advertisements, when it is made by any company, any practitioner also, or any stakeholder, it should be very much cautiously done as per the regulations, because it may be very much threatening for the humans. And over-the-counter medicines, this is also known to you, it's nothing new, just few lines as a revision for you all, has grown steadily for these few years, because the various reasons are there is easy availability, affordability and increased awareness among patients. The easy availability you can understand, it's basically we are living in a 5G situation. During our days in NIH, it was basically one net pack a whole month, that too also get consumed within 10 days, and that is 20 days while thinking what to do, means regarding the internet issues. So that was the level, that is the level of internet today, and everything is accessible in seconds. So that's a easy availability and affordability. The OTC medicines or the non-prescription medicines which we often get from the counter, which means the patients get from the counter, which also not always, even if I just showed you that Drug and the Magic Remedies Act 1954, there are diseases which will be, I will showing you, there are 54 drugs basically. There are certain drugs which are not listed in this 54 drug list category, but that doesn't mean, for example, disease of the respiratory system is not there. So suppose diseases like simple common cold coryza, and you think these drugs, for common cold coryza, if people think, okay, this is better what I get from the marketing media, I get it from the YouTube, I buy it from the counter. As a homeopath, at least you can understand what problem it can create. Just only seeing that, okay, YouTube showed aconite, let us just purchase aconite and have it for the recent coryza, we are having it. You know, it can be X, Y, Z, any medicines for us as per our symptomatology and totality. Simple things can also, need a proper prescription and a proper guidance, and after that it should be given from the dispensing shop. But these simple things, and also since it's not covered by the Drug and Magic Remedy Act, that diseases, there are not all diseases which is covered. So certain simple diseases which are not covered, and the medicines related to them, over the counter, the pharmacists don't think about those. They simply give it, and people are also used to take medicines like that. And after a few days, when he or she is having some drugs which he or she has to take daily. On addition to that, if he's taking some food which he's not supposed to take, if he's taking some additional medicine from these advertisements and having some interactions, then who will be responsible? Obviously, he will be responsible, but this came from where? From some misleading advertisement, and he wrongly took it, and there was some interaction which might have increased the disease, might have caused adverse effect, but at times it might also have some good effect, but that is a certain uncertainty. You don't have any exact conclusion that it will decrease. It might have the other two things also. So you have to be ready for the negative things, and that's why any advertisement when coming out should be proper and should not be misleading. So what are the three basic terms in the definition of misleading advertisements? We have to be very popular, very thorough with these three terms. That is, what is actually an advertisement? It includes any notice, circular, label, wrapper or other documents, and any announcement made orally or by any means of producing or transmitting light, sound or smoke. Okay, this is all actually what an advertisement stands to be. A drug Now, what is a drug? Again, it might be boring to you because from first BSMS first year you are learning what is a drug, what is a remedy, what is a medicine. So I'm not going through this. You know what is actually and what is a magic remedy. Now, at least these things as a part of an Indian, we all know what is a magic remedy. That it is with due respect of anything, we know this is most of the time unscientific. And any other charm of any kind alleged to possess miraculous powers in the diagnosis, cure, mitigation, treatment or prevention on any human disease in human beings or animals or affecting or influencing the structure. From ancient times and in India and other countries also, this is a very famous issue and it's prevailing also. It's not that it has been obsolete, it has been still prevalent. These are the 4 sections which you have to just think when you are actually reading an advertisement to detect whether it is misleading or it is proper. So section 3 will tell you about the prohibition of advertisement of certain drugs for the treatment of certain disease and disorder. Section 4, it will be prohibition of misleading advertisement relating to the drugs. Section 5, prohibition of advertisement of magic remedies. And section 6, them one by one with certain examples. For example, the first 3, the section 3, it is actually related to certain particular diseases and it is very much specifically saying that any advertisement which is related with the miscarriage in a woman or a prevention of conception in a woman or a maintenance of improvement of capacity of human beings for sexual pleasure or correction of menstrual disorder in women. This kind of ads, which are very famous also, you know, in station, in bus depots, they make certain promises. Those kind of promises are actually misleading advertisements. I know many people actually are looking for those advertisements, many people actually follow that. But as a scientific person, you know those advertisements which you find around the rail station, around the bus depots, which promise to increase many things, to enhance, it will be promising for you also to bring results. So these things are actually not to be done. As per the Drug and Cosmetic Act, Drug and Magic Remedies Act 1954, these are misleading advertisements. You need to understand those. And this was I was talking about in section 3T. We have a list of 54 diseases, and any advertisements which say they will be actually considered to be misleading advertisement. And from a basic conception, I told you, if you just see this 54 diseases, that in certain diseases, especially what I found, the disease of the respiratory system, or maybe the disease related to ENT or certain other things, you can come to a conclusion if you went through this. They are lacking here, or the allergic problems, these are lacking here. But they have covered most of the diseases you can go through, and most of the advertisements which we find here in the walls, here when you come to a poster which promises this kind of thing, then you should understand those are misleading advertisements. If I can show you an example with, I think, yeah, this example you can see, this is, I think it's visible to you all. I'm just telling you what is the problem with this advertisement. This is some doctor promising that he can eliminate deafness. First of all, the term eliminates deafness means it's almost looking like eradicating polio from India. Means it will be zero. Deafness, you know, as a scientific person, is it that easy to make it 100 to 0? As a clinician, I don't think so. So, what are the things which are wrong in this advertisement? First of all, this advertisement promises to cure deafness, and this is really insane. And appears to be magical also. Moreover, this publication also have government ex officio, and that is also a danger in this advertisement. But he is promising, if you go through the advertisement, if you read the lines, in between lines, you will find that the promising is as if some mission, again as per guidelines, I don't know how this massage therapy and homeopathy works together. There is research going on basically on this add-on therapies and all that. But I don't know out of what research this publication has come out. I mean, this advertisement has come out. So another one, it is from yoga. The clarity regarding the yoga center, they are promising that they will improve your vision. Okay, fine. At least somebody is not saying that I will cure your vision defects. So they really improve your vision. But what is the problem in this is that the diseases they have mentioned regarding the eye, means all kind, myopia, hypermetropia, astigmatism, presbyopia, all the eye diseases, these are actually in that section 3D, in that 54 diseases list. These disorders of eye, there is one point, probably 11. So again, as per that regulation, that section 3D, you cannot make this advertisement. So it comes under to be a misleading again. And Ayurveda also, this was almost a perfect one, except I think this will be objectionable. I think Dr. Tushar will also agree with me because this is an Ayurvedic product. That is, they have written, as Sir also said, that no medicines can be without a side effect. I mean, it might have good effect definitely. It will also have some negative effect which we need to know beforehand. So one promising angle they have given that there is no side effect, it is totally safe and pure and 100% Ayurvedic. These 3 points I think is dangerously misleading here in this advertisement. So this kind of points, otherwise the whole false claim regarding the drug, which is also again actionable. And in this I don't want to quote any names, but you know, we often see, just coming to our homeopathy part only, we often see that this combination, first of all, combination is controversial, I am not going into that, but this combination will cure kidney stone, this combination will cure prostate. Now this kind of advertisements, whenever you come through, it may be the authentic companies don't of administrating magic remedies shall take part in the publication of any advertisement referring to any magic remedies which directly or indirectly claim due respect of the real things. And this Nirmaljit Singh Narula, who was again making some magical treatments with some magic remedies and himself presenting as a divine emissary. So this person obviously came into highlight when some of his work, just because his key which he gave probably as some magic remedy didn't work out, and that Bhatt got against him, and now you know what is the result, what is the conclusion regarding the court case under Chief Justice A.K. Sikri. It happened, and we know it, how the Baba invested millions in advertising and reporting this kind of, creating this kind of magic environment, certain advertisements. This is regarding certain publication which might be related with certain toxic chemicals, e-waste and other hazardous materials, which cannot be imported or exported without complying with the environmental standard. So now this might not be an exact domain where AYUSH drugs might be coming, but you know, in a long run, this can be also an important issue because these are related with toxic chemicals, and we deal with AYUSH also deal with toxic chemicals and hazardous materials also. So this can also be an important thing because we have many drugs to import and export regarding certain exotic and indigenous herbs or drugs which we at times need to procure from outside or maybe importing from India. So in this respect, we have to go by the guidelines, and any kind of advertisement related to that has to be as per the proper Act of 1954. And lastly, after every act, it is never ended without a penalty, because if you keep on making actions and sections and don't apply any penalty at the end, then it will remain in the books only. So for that, at least a penalty in section 7 has been given, which is regarding the imprisonment, which may be for 6 months or with fine, which may extend up to 1 year along with fine or both. So these are the things we need to understand whether the advertisement is misleading or not. So keep these points in mind. And before I end, we know that this is the reporting format, just like ADR also has a reporting format. Misleading advertisements also have a reporting format, so you can the medicines properly. Even if the patient is administering and taking a careful monitoring of the medicine, you might not get result. What may be the reason? Various reasons it can be, but one reason can be this one, which I am showing you. that is regarding drug standardization. Means drug standardization, as Sir already had said earlier, that it is very important that you should have a proper, exact, authentic source of that drug which you are preparing, and after that collection